working on the mandibular and maxillary right quadrants, and I'm going to start off by making sure that everything's in neutral position. I'm at 8 o'clock position right now, and I'm making sure my patient is underneath my elbow. That's neutral position to make sure I can work on them easily. And I also make sure that the instruments are above their chest so they're easy in reach, and that the light I can easily grab. I'm going to be working on the mandibular right quadrant, and for this we have to make sure that the chin is down when working on it. Now it depends at what clock position we are in. It depends on which spot we are working on. So right now I'm going to be working on the buccal, and that is surfaces towards us, which means I will be sitting here at 8 o'clock. I'll be grabbing my mirror and my Explorer. So in order to check for calculus, I have to explore. But which end do I use? You always check when you're doing your posteriors, at least. You put it on the distal of the premolar, and you have to make sure that it's parallel or that the point is pointing back. That is correct. Now let's see. Let's flip it around and see how that looks. You see how that is not parallel and it's going across the tooth? That is not the right way to do it. Okay, so we gotta make sure that our pointer and our thumb is across each other but not touching. Then we gotta make sure our middle finger is on the shank, and that we have our ring finger for fulcruming. So now that we have established, we will ask our patient to move a little bit away from us so we can see, grasp our mirror, and use our direct vision on those premolars. As you can see, they're easily visible here. Now we will start at the mesial and go distally, and by using that wrist rocking motion. Make sure we roll so we can adapt to the tooth. And since it's a posterior tooth, we don't have to change working ends. We can just flip it around and start mesially again. Rolling, wrist rocking motion, and going into that mesial. And for the anteriors, we do have to check. We do have to change our working end. So for anteriors, that will be towards us. So we will stay at 8 o'clock once again. We will check by inserting the Explorer at the distal, and we can see here that anterior is parallel. That is not the correct working end. For anteriors, there's a different rule. Anteriors, the point has to point towards the middle, and it has to be across the tooth. As you can see, this is pointing towards the mirror, and it is across the tooth. That is the correct working end. And again, we can't work on the whole tooth on this. We can only work from the midline to midline and distal. So for that, we will make sure we can be at 8 o'clock. We will make sure we fulcrum on a few teeth away, and we insert, go subgingivally, and slowly wrist rock our way down and roll. But if you're working on the mesials of these anteriors, this will be away, and you will have to change clock positions. Now we will be working on the maxillary right. So we will have to change positioning here. Their chin will have to be up. This will give us a better view of the arch. Don't be as rough as I am with a real patient. So make sure their chin up. Once again, you have to make sure, it depends on where you're working on. So last time I worked on surfaces towards us, I will work on surfaces away from us. As you can see, surfaces away from us is mesially on the anterior teeth. That's away from us. We will do around 11 o'clock on this one. Okay, so this, I can see this directly. I'm going to grasp my mirror, just retract the lip, and once again, work. Check my working in. That looks parallel. That would not be correct. Oh, let me check. There we go, this one. Okay, so this one looks parallel. You have to make sure you have an established fulcrum when you check. That was my little error. So I have my established fulcrum, and I'm checking again, and that is correct. So now I do the other half of teeth that I didn't work on. Mandibular and wrist rock. And slowly roll into there and adapt to the tooth. Okay, but when I want to do the lingual on this, we have to use indirect vision and light illumination at the same time. So we have to establish our fulcrum of the mirror, a few teeth away. And as you can see, I'm lighting up the teeth right now, and I'm also using indirect vision. So I'm gonna check my working end once again. This is going across the tooth, but I'm gonna double check. That will not. Okay, let me see. Okay, it would be this one. Okay, and since we're still in a weight position, there we go. And we will explore, adapt, wrist rock. Okay, last but not least, now we're gonna use our mirror to retract that cheek. So I'm gonna, let's say I stay on the same, on the maxillary right still. I want to work on the posterior teeth. I will tell my patient to turn a little away from me, and now I will use that mirror to pull on that. I need to fulcrum, and I will pull, fix my light a little bit. Now I can see this more better now. Rather than just using my finger, now I'm also able to retract it and see more distally of these teeth. And then again, I will explore. So now I can. Thank you for watching.